Breast cancer. What is breast cancer? Breast cancer is when there are cells in the breast that begin to grow out of control. These cells can form tumors that can often be seen on x-rays or as felt as lumps. The tumors can become malignant, which is when the cells grow into or invade the surrounding tissue, or spreads to distant areas of the body, also known as metastasizing. Breast cancer is way more common than most people think. It has been found to be the most common cancer among American women today. Breast cancer is a life-altering and life-threatening disease which produces an emotional experience that is accompanied by many different stresses, challenges, and disruptions.
The female breast is primarily composed of fatty tissue and mammary glands. Mammary glands drain into the lactiferous sinus, which connects them to the nipple. During pregnancy, mammary glands swell in order to accommodate milk production. This process is regulated by hormones. Breast cancer is a malignant neoplasm of the mammary gland. It is one of the most common causes of cancer fatality in women. Early detection through regular breast examination and mammography is key. Through self-examination, irregularities, such as lumps or masses, can be detected before the disease has had a chance to spread. The danger associated with all cancer, but especially with breast cancer, is that the disease can travel quickly once it has invaded the lymphatic system. The lymphatic system provides the perfect harbor for cancers to travel throughout the body.
Breast cancer has been found to be the second leading cause of death among women in the United States. The causes of breast cancer are not fully known yet, even though there are a number of risk factors that have been identified. There are many different signs to look for when looking for breast cancer. Those signs include looking for a lump or thickening of the breast that may feel different from the rest of the breast. Checking your nipples to see if they have become inverted or pulled in, or if the shape of the nipple has changed. Looking to see if there has been a change in skin texture, such as dimpling. You also want to notice if there is any discharge from your nipple, or if there is a rash or redness on the skin around the nipple. Swelling in the armpit or around the collarbone can also be identified as signs of breast cancer. Early detection of breast cancer is very important. There is a large amount of women who are not getting mammograms when they should be. It has been found that if there is a family history of breast cancer, women are more likely not to get a mammogram done than if there is no family history. This is because they perceive themselves of being more susceptible to developing breast cancer. Depending on who in your family has had breast cancer, it can increase your chances of getting breast cancer by 50%. This is if they have tested positive for BRCA1 or BRCA2 gene. Getting to know your family history of breast cancer is important. Nearly 15% of women with breast cancer have a family member that have also had breast cancer. There are many different types of breast cancer. Some of the different types include ductal carcinoma, invasive ductal carcinoma, tubular carcinoma, medullary carcinoma, papillary carcinoma, inflammatory breast cancer, and many more. There are more than 3.1 million breast cancer survivors in the U.S. today. That being said, women use both conventional medicine such as chemotherapy or radiation and complementary and holistic medicine. A combination of both complementary and conventional medicine have been found useful. The use of conventional medicine helps to kill or fight the cancer, while the use of complementary or holistic medicine for women who have had breast cancer help to balance the whole person physically, mentally, and emotionally. In many cases of breast cancer, women have found complementary medicine to work by reducing symptoms, easing their treatment side effects, and improving their quality of life. Did you know that 1 in every 8 women in the United States is diagnosed with breast cancer or develops breast cancer? That being said, after a woman receives treatment for their breast cancer, they often have to undergo a surgery called a mastectomy. A mastectomy is the removal of the tumor and some of the breast tissue. After the surgery, some women are able to receive reconstructive surgery, while others are not. It all depends on the type of breast cancer you have. There was an interesting study that was done on microvascular breast reconstruction and lymph node transfer for post-mastectomy lymphedema patients. Only 4% of patients that seek breast reconstruction have been said to have been affected by lymphedema. However, many women who have had breast cancer and mastectomies are at risk for getting lymphedema. The risk is increased even more for cancer patients if this cancer has spread to the lymph nodes and some of the lymph nodes have had to be removed. What is lymphedema? Lymphedema is where there is fluid retention and the tissue begins to swell due to the fluid retention, which is caused by a compromised lymphatic system. This is very common when a woman has a mastectomy and she has to get some of her lymph nodes removed too. This is because she no longer has all of the lymph nodes working to filter her blood. Lymphedema often does not go away. Lymphedema has been found to cause many patients distress along with affecting their quality of life. The study found that lymph node transfers have been shown to reduce the measure of lymphedema along with improving a woman's quality of life. The use of CAM therapies have been shown to help women who are going through breast cancer. That being said, yoga has been found to have an effect on women going through breast cancer treatment, along with women who have had lymphedema for their breast cancer treatment. Exercise that is controlled has been shown to have a positive effect. There has also been a positive effect that has been found on yoga and its effects on lymphedema. Nutrition can also have an effect on breast cancer. Nutrition has been found to play a huge role in the risks of breast cancer. There are many women who are obese. Obesity has been linked to several different diseases, including breast cancer. Over the years, obesity in overweight people around the world has increased drastically. With that being said, we have also seen an increase in disease and cancers. Obesity has been found to increase the risk of someone getting breast cancer. With that being said, diet has been found to make a big difference. The risk of cancer can be decreased by consuming a nutritional diet. Broccoli is a superhero of vegetables. It has been found to contain an abundance of nutrients. It is high in fiber and vitamin C. It is a good source of potassium, vitamin A, and vitamin B6. Broccoli is an anti-inflammatory and has been found to have cancer-pertaining properties. According to Carol Kenny, many women have found that integrating a mind, body, spirit, self-empowerment program for breast cancer survivors to be helpful. Women who have participated in this program have found it to help reduce distress, improve quality of life, reach a deeper sense of meaning and a purpose of life, along with experiencing a greater self-sense and well-being. So let's recap. Breast cancer is something that many women in today's world go through. Knowing what to look for, such as signs and symptoms, is important when you think you might have breast cancer. Early detection is key, and getting mammograms is important. There are different types of breast cancer that women can get. The use of both conventional medicine and complementary medicine can help in many different ways for women. Most of the time after treatment, women have to undergo a surgery to get a mastectomy, and it can increase their risk of lymphedema. Nutrition also plays a big role in the risk of breast cancer.